Hello and welcome back. I'm Eric Sunset, your host of the DocBuddy Journal. This is episode 42. We're recording it on November 8th, 2023. Got a very special guest with me today. It's Katie Pierson. She has a long list of accolades, doctor of nursing practice, registered nurse. She's got the orthopedic nurse certification, and she recently achieved her CASC cert, which is the Certified Administrator of Surgery Center. Congrats on that, Katie.
Thank you.
She has got an obviously strong background in healthcare. She's got experience managing joint replacement programs, administering ASCs, and much, much more, all based in Austin, Texas. Thank you, Katie, so much for joining us today. How are you?
I'm doing great, Eric. Thank you so much for having me today.
It's my pleasure. We've threatened for a long time now. It's probably been about a year. We've threatened a long time. We're going to get you on the podcast. Got to share some of your expertise, and I'm so glad we can finally make it happen.
Me too. Thank you so much for allowing me to be here today.
You got it. Anytime. Well, the bulk of our listenership on the DocBuddy Journal is sort of housed in that ambulatory surgery center vertical, or place of care, I guess would be a better way to put it. That's an area you know really well. And we're coming up on essentially another new year. We're less than a quarter away from getting into 2024. The topic of technology in the ASC has never been hotter. We're sort of seeing a sea change where everybody knew they needed to have it and some were using it, but now you're getting into a reality where you really have to have it. How are you seeing this shift unfold from your perspective in an ASC?
Yeah, it's a really good question. Having spent the beginning of my career in the hospital setting and then moving into the ASC setting about 6 years ago, I had assumed that ASCs would have been more progressed in technology because they're a newer setting for healthcare, right? So they've been around since the 70s, where hospitals have been around since, I don't know, longer than I can even imagine right now. And yet you walk into any hospital and they're undoubtedly is going to be a EMR of some sort set up. And yet you walk into most ASCs these days, and that's not the case. So I have just found it really intriguing and, of course, challenging, but in a good way, to say, why are we behind the ball, and how do we get this arena up to speed in technology, because they're missing so many opportunities for efficiencies, for return on investment in regard to reimbursement from the payers. Time is money in healthcare. So I've definitely seen the challenge of how do we get the ASC setting up to speed. And I'm assuming a lot of it is due to the fact that they don't necessarily pull in the same amount of money as the hospital setting, right? They just don't have that capital to spend as easily as the hospital setting.
Yeah, I think you're spot on there, and it remains to be seen if Medicare and if CMS issues any sort of mandate for the ASC. As procedures come off that IPO list, especially the cardiologic type stuff, Medicare may have a change of heart and say, you know what, since we're reimbursing you guys here in ASC land, maybe it's time for us to get a little bit of data back out. We'll see. I don't have a guess there.
Yeah.
But when you look at the lack of tech in the ASC, you mentioned efficiency. And for me, sitting on the vendor side, I hear about some of the workflows from administrators and surgeons and clinicians and think, oh my gosh, you are running your surgery center with a boatload of Post-it notes and handwritten things jotted down all over the place, and just cannot fathom that is reality. And I'm obviously joking. There's some hyperbole there. What are some of the lowest hanging? Oh no! Well, don't tell me that. Don't tell me that.
No, there's truth to it for folks, though, right? There's truth to it for some people that's the way they've always done it. That's the way that it's always been done. So for them, there's always this assumption that they'll work faster with their binders, with their Post-it notes, with their paper. And the real challenge is helping them reimagine the way that they work. And that's probably been the biggest shift that I've come across for some people, to say, no, we need to literally start all over again from what you need to accomplish in your day, and use the technology to serve that. Because I have walked into facilities now who have quote unquote adopted technology, and what they've done is taken their piece of paper and turned it into a computer program, instead of looking at as, what is the program capable of to help me function for the day. That's probably been the biggest thing I've seen in that mind shift of paper to technology. I just wanted to add that.
Oh, I'm glad you did. You can have the same type of digital silo as you do like a paper silo to get really into the vendor speak with you. But with what we're talking about is efficiency. What are some of the lowest hanging pieces of fruit that you think tech can bring to an ASC, just in terms of simple efficiency, getting things done faster?
Sure. I think adopting an EMR is always, one of the best things you can do, but also vetting to make sure that your EMR is not a piece of paper that you're just turning into technology, and then building it out to meet the needs of your facility, and trying to find a program that's going to be all encompassing. I know that's really hard to do, but people don't want to go to 18 different programs to complete their job for the day. So really trying to find something that will meet most of your needs. Of course, there's not like a all everything, pretty package right now out there, but some of them are trying to get there. So I think an EMR, if there's anything, that would be something I'd say is first, because it's going to benefit so many people, your physicians, your staff, like so many folks will buy into that and adopt that faster than they will just a single, I'm thinking about logs, to turn binders into logs. Who does that really benefit at the end of the day? More the administrative folks.
Right.
So it might be harder to get your stakeholders to agree to buy something like that, although it's usually cheaper too. So really, it's hard to answer this, because it depends on how much money do you have to spend, what is it that you're trying to accomplish, and who's excited to adopt the technology. Is it your administrator, or is it that new nurse that just came from the hospital that's like, I had an EMR and I need an EMR again? Or is it the doctor that says, maybe that same concept of, I'm at the hospital, all I have to do is click a button and everything is translated for me. So I think it really just depends on who's chomping at the bit to get something adopted, and then kind of take that and run with it.
I want to pick at that a little bit more on the surgeon or on the provider side of things, because you're a surgeon, you've got an orthopedic practice, or you have your own clinic-based practice, and Medicare has essentially mandated you to buy and use an electronic health record.
Sure.
They're not cheap. They don't save you time. They're not your favorite thing about your job. And in fact, the data shows it's usually your least favorite thing about your job as a provider. How do you get a surgeon excited about technology in the ASC when they've been snake bitten, everywhere they've turned, from their clinic to the hospital, and now the ASC is going, hey, we want to implement an EHR. What do you tell that doctor?
If you can do it before your center even opens, it's a lot easier than trying to throw it in there once things are already going. I've been a part of both of those sides, and I can tell you that, if you're opening up an ASC, just kind of building it into the day and into the expectation typically is much more appreciated and accepted. And also, I hate to say it like this, but I guess it depends on the experience of technology with your physicians too. Some of these newer docs, again, they've come out of school, they've learned on the computer, they've only charted in hospitals on the computer. So it's kind of like nursing too, where now you throw them a piece of paper and they're like, I don't know what to do with this, because I've never learned how to dictate or handwrite an entire chart. So I think that's kind of dependent on it, but otherwise, starting slow is the way to go for those that are a little more apprehensive. Maybe just starting off with their op notes, or just starting off with click here for your orders, or click here for your immediate op notes. I can tell you, my guys now we're just finally getting to the last pieces of utilizing our EMR for them, because it takes a minute if they're not utilizing it all right from day one.
Sure, that makes total sense. Obviously, if you're a de novo facility, just buy it, and that's how we're doing it.
That's right.
No questions asked.
Oh,
And
a
what
lot of
about, let's turn our attention a little bit to the administrative side of the house. Obviously, there's some amount of technology you essentially must have. You have to be able to schedule patients, capture demographics. You need to be able to bill for whatever it is that you're doing at the surgery center. So there's sort of a baseline where the clinicians can maybe get away with more, or more of a lack of technology, I guess, to phrase that correctly. What's going to make an administrator the happiest or most excited in a technology sense at their facility?
I don't think it can be emphasized more that data is king. And it's really what drives the administration side in all aspects, actually. I was going to say financially, but it's outcome based to determine really what are we going to focus on in the next 6 months, year. So really any kind of analytical program that you can get going is ideal. Some of these EMRs have analytics built into them. So it's also knowing how to use it, because it's one thing to say that you have it, but then to also understand how to use it, how to get the information. What are you looking at? Making sure that the data is clean, of course, which is sometimes a struggle because it's usually user dependent on the data going in for the data coming out. And what we've done there is, for example, same day cancellations. I'm just going to use that as an example. So on our scheduling system, it was capturing it, but I wasn't sure if the number was correct. So for a month, I had to manually track it. I'm like, just for 1 month, let's make sure that this is accurate, because be careful of trusting all technology as well. You can always double check it, with a manual process there. But anything to give you data to help support, your processes, to support purchasing, to support, because a lot of these EMRs too will have, to your point, billing in it as well. So you can kind of see on a daily basis, what have you collected? What do you need to collect? Because that's really what we're held accountable towards, is the money coming in. And then from money going out perspective, are you utilizing anything like a QuickBooks or something like that to be able to track that? I can go in 10 different directions with that answer, so I'm going to stop there for a second because I feel like
Yeah, take a breath. That really is a display of your expertise in the field, because you can go in 10 different directions. I know one of the things I hear often from administrators is concerns around case profitability, and that has many more layers to it than even I would consider myself a conversational in. But it goes from the purchasing at a good price to then making a decision that this is the implant or the device that we want to be using for blend of outcomes and financial reasons. How do you see data, or how do you use data to help drive decisions related to case profitability?
Yeah, historically, that's been a very piecemealed process. I know one or two of the EMRs out there right now has worked really hard at getting that as a more automatic thing for administrators to be able to see, if I do this case, how much money will we make on it? But to your point, it really just comes down to understanding what are all the costs that are going to be associated with that case, from staff to supplies to the implants, and then what is that payer going to pay you depending on what that patient has. But honestly, that's definitely been a challenge out there, because to your point, that's what drives the business is, what are we going to get on this case? If we'll do a hip injection that we'll get paid $10 on, versus a spinal cord stimulator implant that pays like 30 grand, so it really does make a big difference. And it's something that all administrators need to be very privy to when they're looking at their schedule and seeing, what does this day make sense from a profitability standpoint. And it really depends on what technology you have available to you to get it. So if you're creating spreadsheets to say, typically we get paid this because this is our implant cost, that might have to be where you go right now, because I don't know of any uh, outside of an EMR system that really helps you determine that. And maybe we can put something together and make $1 billion.
Sign me up. I'm sure it's that easy too. Yeah. No, this might be a little bit more of a philosophical point and put you on a soapbox, which I'm trying to do here. But in terms of trends with payers, when you look at the ASC, you've got the very rare win-win-win for the providers and their facility, the patient, and then the payer. You have a cost savings versus inpatient care. We're not getting the care at all, and then you end up with very good outcomes. How dare a payer pay next to nothing and risk profitability for cases, which obviously we in healthcare don't want to be too shy to talk about profitability, because without it, you don't get to turn the lights on. You don't get to open up your facility every morning and treat patients. It has to make money. So how dare a payer risk putting you into the red on a procedure that a patient needs done?
Well, I guess that kind of brings us full circle from the beginning of our conversation, where I said in hospitals, I always see technology, and then I come into the ASC setting and it looks like I'm back in the 1980s. And I can only imagine that part of that is driven by the fact that they don't get the same reimbursement as hospitals on many cases. I mean, let's be honest, politics are a big driver into this. The hospitals have a huge thumb down on the payers, and there's a lot of work, there's a lot of lobbying that's being done to get the ASC procedures better reimbursed. I'm very excited about the CMS rule that just got passed. Was that last week? That approved 11 procedures instead of just that one dental case. So I think we are making a little bit of headway. However, we're definitely still way behind in the times. And unless you have folks that really understand it and then can take the action to help the payer see, we're also still such a small component of healthcare. So they're going to spend their time and money and energy on the bigger areas like the hospital systems. And until we keep fighting, or make, I don't know, until we all band together. It's still very segmented in that respect too, that even each state is so different in the way that they're handling how to approach the payers and how they're approaching the federal government on getting reimbursed, because again, it depends on your relationship with hospital systems. Some ASCs are partnered with hospital systems, so they have to be very careful in how they're navigating those conversations, because they don't want to lose out on some of the benefits of being a partner with them. So really, I mean, yeah, it's going to take a minute.
Yeah, and you hit on one of the keys. We had the ASCA CEO Bill Prentice on earlier this year, and he shared that the biggest challenge facing the ASC industry is just visibility and recognition.
Right.
So I want to share a plug for our friends over at ASCA, which is the Ambulatory Surgery Center Association. If you want to get involved, at least with the annual conference they are going to host in Orlando in 2024, visit ascassociation.org, because they are fighting the good fight for all of our friends in the ASC space.
Yeah, it's really exciting to hear about those 11 approved procedures. Hearing Bill just speak last month about it at the Becker's conference, and how, they've done a lot of work to try to help CMS understand the importance of getting those procedures approved. So I'm very grateful for their work that they're doing. And Kara Newberry, too, of course, is always such a great resource there as well. She's fighting the good fight.
Yeah, thank you to our friends at ASCA National and for all of the state ASC contingents as well.
Sure.
So let's change gears a little bit. We've talked a lot about technology, and technology should be a way to ease folks' workload, but it isn't always. So, Katie, in your experience and in your estimation, how can technology help combat things like physician burnouts, staff burnouts, and just a general healthcare sort of malaise that's fallen over the industry post-COVID? Just
That's a
make a
really
note.
good question, because really depending on how you're utilizing the technology, it can help you or hurt you. I have had the opportunity to experience it in both capacities, in that by clicking a button, most of my work gets done. It's automated. I just have to fix anything that's not right and I can move on with my day. Whereas I've used another system where I have to click into 15 different areas and it's just so convoluted and it honestly doesn't make any sense. So sometimes I wonder who comes up with this stuff. Because I'm like, we're utilizing technology, but not in the way that it should be utilized. And it gets really frustrating as a frontline worker because you're working towards the computer instead of towards the patient. So I think anything we can do to make it easy, right? Keep it simple, make it easy, make it so, most fields are already populated and you only have to chart by chart things that aren't actually there or whatever. The more that you can do that, the more your end users are going to be open to utilizing the technology. Otherwise having to type an entire paragraph out for each section doesn't make any sense these days. Make it clickable, make it easy. I use my phone, I use apps for everything. Everything's pushed towards me. I'm not pushing towards it. So that's probably what you want to be looking for, at least in utilizing technology. Otherwise, people are going to get angry very quickly.
Yeah, well put. And speaking again on the vendor side of things, you used to hear, "Oh, my doctors aren't good with tech. They're tech illiterate. They're afraid of the computer." It wasn't true a decade ago, and it's even less true now. Everybody wants technology to help them. Nobody wants bad technology, though.
Right.
Why would you? Because once you've seen and used good tech, that's the way it should be for everything.
That's right. And it's
So
what we
looking at
expect. We expect good tech. So you put a piece of tech in front of us that looks like it's from 1990, and we are complaining about it, whining about it, trying to get rid of it as soon as humanly possible. So yeah, we're very needy in that respect now, that we like to have the latest and greatest, because it is always evolving, and now even more rapidly every day, right? It just gets faster, it gets easier to use in so many other aspects of our life. So you hear of programs now that are trying to emulate Amazon for supply management, right? So it's anything you can do to try to make our work world function similarly to our personal health or technology world. So that's what I'm seeing for sure.
And that company just better hope Amazon doesn't get interested in supplies for ASCs, because that would
Because then,
potentially be revolutionary. Yeah.
Amazon started off as a bookstore, right? So who knows
Yeah.
what they're capable of anything. I'm convinced of now.
Yeah. Incredible logistics there. Well, let's get out the crystal ball here, Katie. We're gonna get out the crystal ball, light a few candles. We're gonna try to look into the future here. What do ASCs absolutely need to be doing right now to prepare for 2024?
If you haven't already adopted a electronic health record or medical record, you should have already been doing that, hopefully, because whether you like it or not, it's here and it's here to stay. And it's what your staff, your physicians, your patients, and hopefully too, the government will be expecting very soon. So it's here to stay. It's you rip the Band-Aid off.
Fair enough. And hard to argue with that. As a patient, we're all patients to some extent, or we at least know a patient, even if you are, outside of the healthcare system.
Sure.
As a patient, my provider, my hospital, my surgery center, it really better have an EHR just for my own safety.
Right. Yeah. It kind of makes you feel more warm and fuzzy when you know that they're utilizing it. Actually, it's funny. I was checking in a patient yesterday, and we have them sign on an electronic signature pad. Just to be clear, we have them sign 5 times on an electronic signature pad, and he was complaining that he couldn't already have clicked something prior to checking in to have already had done all of that work. So it's absolutely expected to make it easy for everybody.
That's my new favorite patient story. That's fantastic.
I was like, we have technology. It's just, to your point, not where everyone's expecting it to be, because I have my app on my phone that I can just click, 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 click on so many other things. So
yeah, exactly. Yeah. Well, Katie, one of my favorite things to ask guests, it's a hot topic on the pod too, is AI in healthcare, or so-called AI in healthcare. What's your sentiment towards using things like Chat GPT or artificial intelligence in the care of patients?
Yeah, it has been such a buzz thing to talk about, and an exciting thing to talk about, because again, anything that can make our lives easier, we're gonna always navigate towards that, or go towards that. However, as you mentioned on your last podcast, and I read an article recently too about the two Chat GPT versions being so different, whereas the latest one actually is failing more math questions than the first version. I would definitely say to be cautious, very, very cautious about utilizing it, implementing it, at least anytime soon. Let them work out the bugs, let them figure out what's the best methods to use it, or what's the best algorithms out there, and I hope that we continue to use it more as a resource, more as a adjunct to practice versus actual practice. However, I can also appreciate that as healthcare is continuing to see a decrease in staffing availability, resources in remote areas, you name it, I can see how it's going to be a bigger drive in those aspects, and I hope that folks are just being smart about it and not doing it because it's easy.
Yeah, well put. Well put. I'm generally one of the last people to ask for regulation around industry, but this seems like an area where somebody needs to really put their foot down. Maybe it's the AMA to say, here's how you can use AI, but here's where you
Sure.
need a physician or a clinician or
Yeah.
somebody with some actual expertise to weigh in, as opposed to firing up a chat prompt for an answer.
Right.
But that's just my opinion.
Yeah, I agree.
Yeah, it seems kind of reasonable, but
Yeah.
we're moving really quickly with AI, or so-called AI and
Well,
LLMs.
it's been useful for so many folks in so many avenues now, that the trust is actually gaining on it, because it's helped some people in some arenas, and I mean, and I guess in healthcare too, but I get also, let's be smart.
Yeah, and to be clear, I'm not at all opposed to the use of these things. They are very helpful, or they can be helpful, but they're also not perfect. They're far from it,
Right.
and just an ounce of caution is worth a pound of prevention. Or somebody help me out
Yeah.
with that one. You can scream at your car listening to this. You didn't get the saying. Be cautious. So, Katie, with all that to say, we really appreciated your expertise on tech in the ASC, AI, and healthcare. Is there anything else you want to share with listeners of the pod?
I know technology can be a really scary thing if it's something you're not comfortable with. So, if that is the case for you, find your friend that is comfortable with it and have them do it. Because I promise you that if you use it right, it can help your day instead of hurt it. You just have to know how to use it and be open to changing some of your ways. I'd have to say that's probably the biggest thing I've come up against with all of this.
Well, I don't think truer words have ever been spoken there. If anybody needs a shoulder to lean on, where can listeners connect with you? Can they find you on
Uh,
LinkedIn or Twitter?
Yeah, I am on LinkedIn. You know, I haven't signed into Twitter in a long time. I have one, but it's been a minute. Or now what is it called? X, right? So
Yeah, X, right.
yeah, yeah, X.
Excuse me, not
And
Twitter.
I refuse to get a TikTok because I feel like my life would just be consumed in it. But you know, I am on LinkedIn. Absolutely, you can find me at Katie Pierson DNP RN ONC CASC.
Oh yeah, yeah, rock them. Those achievements are hard earned.
Yeah, thank you.
Well, on behalf of the DocBuddy team, thank you for listening to this episode of the DocBuddy Journal. If you're not already, be sure you're subscribed on Apple Podcasts, Spotify, and YouTube as well, so you can always get the freshest episodes of the pod. Until next time, I'm your host, Eric Sunset. We'll talk to you again soon.